This is Biernacki, and today I'm going over my ultimate plantar fasciitis and heel pain guide. Do you have heel spurs, plantar fasciitis, bottom of the foot pain that's just not getting better? Here's my tips and tricks that I know will work for you and will help, and we're starting now. Causes, risk factor, heel spurs versus heel pain versus nerve pain versus plantar fasciitis. How do I diagnose it? What kind of imaging do we do? How long is it going to take you to get better? All the tips and tricks for heel spurs, for plantar fasciitis, for the nerve pain, and the potential complications if you don't do anything about it. Make sure you stick around all the way to the end because I'm going to give you my best home remedies. Heel pain is pain, swelling, stiffness in one of the heels. If this happens, the most likely cause is plantar fasciitis, but it can be a heel spur. It can be nerve pain. It can be Achilles tendonitis in the back of the heel. You could have a calcaneal heel spur. So the actual bone can have a stress fracture. You could have broke it. You could have just bruised it up really bad. There's some skin issues. So I've seen people with corns, warts. If you have any of these problems, check my links below, especially if it's nerve pain that's radiating, numb at night too. That's something more than just plantar fasciitis. I have guides on all this stuff, how to diagnose it, how to treat it. This is a horrible disease. It's said that over 40% of people in the world are going to have this, and they're going to have it for at least 3 months at a time. I'll tell you, 99.9% of the time, people do not need surgery. I'm telling you, this stuff works because I have so many people coming in every day, and this stuff just works. I'm going to go over some of the surgical techniques. If you have pain on the back of your Achilles tendon, if you have pain radiating at nighttime, this could be Achilles tendonitis. It could be a compressed Baxter's nerve. It could be peripheral neuropathy. Sometimes if one leg's shorter than the other, or you have knee arthritis, or your foot's turning in, or your knee's turning out, or if you have severe hip problems, this is a more upstream biomechanical problem. These are important to take care of, not just your plantar fasciitis if you have them. How long does it take to get rid of plantar fasciitis? Here's what I always tell my patients. You should have immediate relief at the beginning for a good chunk of your pain, but then after your initial relief with the pain methods we're going to talk about, you should get a total of 25% better the first month, about 50% better the second month, and about 75+% better the third month. What is plantar fasciitis? The plantar fascia is a thick web-like ligament on the bottom of your foot that connects your heel to your toes. It acts as a shock absorber when your foot turns out. It prevents your feet from turning out and basically prevents your feet from dislocating and hitting your shin. Studies show that over 40% of people will have this. If you have tight hips, lower back, hamstrings, weak knees, weak thighs, hamstrings, your plantar fascia is going to absorb more wear and tear. If you weigh more, this leads to microscopic tearing in the plantar fascia. If this gets worse, it could lead to bone damage as it inserts, then it could lead to rupture and immobility. That if more than 6 months go by, it changes from plantar fasciitis, where you're actually inflamed and tearing, and to plantar fasciosis. So fasciosis is actually the death of the plantar fascia. So it actually gets thicker, more swollen. When I evaluate people, I actually use an ultrasound to check the thickness of the plantar fascia. Normally it should be about 4 millimeters from top to bottom, and there shouldn't be a heel spur. But as people have this for months or years, it gets so thick where it's maybe now 2 to 3 times thicker. That could be fasciosis. The simplest way to think about this is the fascia is stretching, it's tearing. You discover that you have microscopic tears. It's most common in people between the ages of 40 and 70, people who are more overweight, people who are more active. It's more common in women than men. It's very common in pregnant women. Talking obesity, overweight. If you walk unevenly, you're more likely to have plantar fasciitis. And it's such a common disease that anybody who has these issues will probably get plantar fasciitis. And it's also correlated with poor foot gear. And I'll get into barefoot shoes versus very supportive shoes. What's the difference between plantar fasciitis and a spur? When you get plantar fasciitis for a long time, it actually starts to rip out of the heel, and the bone almost tries to heal to chase it. That's a heel spur. There's a lot of studies on heel spurs that can be a little bit confusing, but the bottom line is 1 out of about 10 people will develop a heel spur in their life, but only about 1 out of 20, so about 50% of those will develop pain. I see so many people with heel spurs, but don't panic. There's so many things we're going to talk about in this video that can help with both your heel spur and plantar fascia, where you can skip the dangerous surgeries. How do doctors diagnose plantar fasciitis? Well, the first thing is I check loading up your big toe joint and checking how tight the plantar fascia is. That's called the windlass mechanism. You can feel the plantar fasciitis with your thumb. Almost always at this case, it will be sore. If it is not sore, there's a good chance it's not plantar fasciitis. It could be a nerve issue. It could be a heel stress fracture. It could be the heel spur. It could just be bruising. Sometimes people step on things that could be the problem. It's almost something in there. It could be fat pad loss. So we can get an x-ray. An x-ray will show us if there's heel spur or arthritis somewhere else. And with imaging, we use an x-ray. So what I'm looking for on the x-ray, you can't see the plantar fascia, but you can see, is there a heel spur at the bottom? Is there an Achilles tendon heel spur in the back of the heel? The good news is I'm gonna go over my treatment. So a 5-stage guide that works for 99.9% of people. But let me talk about the surgery so that you understand what it's actually doing. A tight calf muscle makes your foot turn out and puts more pressure onto your plantar fascia. So one surgery that's proposed is the gastrocnemius recession. So lengthening the calf muscle lets your foot move through the ankle easier and puts less pressure on the plantar fascia. The gastrocnemius recession will definitely, but this is extreme. It's going to take you so long to heal, and it's just like rupturing your Achilles tendon. You're going to lose strength through your foot, so why not just do the easy stuff that lengthens your calf muscle and corrects your posture anyway? I really think that the benefits of the calf lengthening are the fact that number one, we lengthen your calf, making you walk straighter, and number two, it puts you in a cast for months where your heel has time to heal anyway. So why not just do that without having a more dangerous surgery? The studies for gastrocnemius recession are pretty good. In this 2018 study, they looked at patients and the majority of them had good pain relief. I would agree with that. I used to do this procedure, but there are complications like nerve pain in the calf or difficulty healing. This is my 5-stage ultimate plantar fasciitis and heel spur treatment guide. It works great. Number one is a biomechanical exam. This is the real key. If you have plantar fasciitis, but you have like a slipped disc in your back where your nerves are coming down to your feet, you have almost no chance of getting better. Even if your plantar fascia heals, you will not be happy with your doctor. And this is the type of stuff I see with people. You have to actually check your lower back, your hips, your knees, your feet, and your plantar fascia. That doesn't mean you can't get your plantar fascia better, but these are reasons that you have to target. It's going to help with shoe gear, it's going to help with insoles, it's going to help with all your decision making. If you have really tight lower back and hamstring, which most people with plantar fasciitis do, and you don't try and get those more loose and healed and feeling better, you have absolutely no chance of your pain not coming back. Even if you go in a boot for 3 months, you'll feel better for a little bit, but as you start walking with your tight back and hips, your foot's going to start getting sore again. That's the problem. But if someone's punching you in the shoulder 10 times a day, nothing else matters. And that's where the biomechanical exam and the pain relief come in. Proper biomechanical exam will help with all decision making. Check your hip strength, your knee, hamstring, calf, foot strength. This is what I always start with. We do a physical exam, make sure there's no broken bones, joints, no dislocations, no severe problems that will prevent us from getting better. Then number two, you want to do pain relief. So these are kind of your injections, your pain relief modalities. Number three is you want to support the foot to prevent it from twisting out and re-rupturing. Number four is your rehabilitation strengthening. And number five is get that muscle strength going. You have to strength train. For the biomechanical exam, if you're injured plantar fascia, is consider modalities like icing. Icing works really well, 15 to 20 minutes at a time, 3 to 4 times per day. Your inflammation and soreness will come down. Now it's less inflamed, but you still have those microscopic tears. You potentially still have that spur. What you also want to do is prevent it from getting re-damaged. That's kind of where cushion on the bottom of your heel, gel pads can help at the beginning. And I have a lot of my favorites linked down below. A good thing to try is anti-inflammatories. That's your ibuprofens, your Motrins, your Advils. I always recommend take 400 milligrams every 4 hours or 600 milligrams every 6 hours or 800 milligrams every 8 hours. Never do this for more than a week or two. It starts putting your kidney at risk. So medications aren't the answer. Naproxen's one of these as well. Tylenol can help too, but you don't want to use Tylenol long term. You could even use Tylenol and ibuprofen together. Steroid injections can work really well. If someone's in severe pain, like they can barely walk and move, I love a steroid injection into the heel, but this is like a one-time thing. We don't want to keep doing this for the rest of your life. We just want to give your heel a turbo boost so the inflammation calms down, but we also want to combine it with good shoes, good orthotics to keep pressure off. Another easy treatment is creams. Anti-inflammatory creams. These creams can work really well, but again, you want to stop that punch too, not just relieve the pain. And then things like physical therapy. So with physical therapy, I'm going to lump my favorite treatments under here. So these are massage, icing, hot cold modalities, Epsom salt baths, red light therapy. I love red light therapy. It might not be the best for the bottom of the heel, but big muscles like your thighs, your glutes. Ultrasound therapy can be very beneficial, but again, it doesn't get to the root cause. One thing that I am a very huge fan of, and I use almost immediately on everybody in my clinic, is shockwave therapy. Shockwave therapy essentially uses sound that goes through gel on the bottom of the heel, and that sound basically stimulates that ligament. Then you want to strengthen the actual plantar fascia. So there's a lot of exercises like toe curls, marble pickups, short foot exercises. I have a guide that goes over all of these in depth down below. Make sure you check out that video. It makes a big difference. So here's the big secret and the home remedies. The plantar fascia is a damaged ligament. It needs time to heal. There's no 5-minute tricks. The ligament actually takes months to heal. The real trick is getting it supported so you're not taking damage nonstop. I'll tell you personally, if we break it down to those sequential 5 steps, almost none, I can't even think of one in years that has needed surgery, just about always gets better. It's not expensive. It's not dangerous for most people, relatively. You know, shoes and insoles cost a lot, but we're not talking like getting a $5,000 product or a $10,000 surgery. This stuff just works. I'm telling you, I see so many patients with heel pain. It works well. If that didn't help you, check out my favorite home remedies where I go over stuff like, do essential oils work? Do creams work? Do injections work? What about lavender? Does all that stuff work? The answer is yes, a lot of it can work, and we're going to do our countdown. Even CBD oil. The CBD oil, there's actually great studies. All that stuff works well. Check out that guide on my top 10 home remedies for heel pain that relieve pain. Check that out. Hey, guess what? We have a phenomenal book. I believe this is the premier book on chronic nerve pain and peripheral neuropathy pain on the planet. I've put years of work seeing tens of thousands of peripheral neuropathy patients, working with some of the best diabetic endocrinologists, the best doctors, the best neurologists in building out this book. For you, my viewers, we have a discount code available. Get on our mailing list and get that book down here.